Good afternoon, everybody. Today is Wednesday, April the 8th, 2020. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Al Wong, our Regional EMS Director, and Dr. Brenda Weiss, the Administrator for our Office of Public Health. So since our press briefing yesterday afternoon, we have had 108 new positive cases of COVID-19 in Montgomery County, bringing us to a total of 1,402. These positive individuals are from 31 municipalities, none of which are reporting their first cases. This keeps us at 59 of our 62 municipalities that are home to individuals with COVID-19. And for those of you who've been wondering, the three municipalities that so far have been unaffected are Bryn Athyn, Pennsburg, and West Conshohocken. Today's individuals range in age from 15 to 99 years old. As always, you can check our county map at montcopa.org/COVID-19 for an update of the municipalities and where individuals are located. The age brackets today, we have 6 individuals between the ages of 10 and 19, 5 between 20 and 29, 12 between 30 and 39, 17 between 40 and 49, 23 between 50 and 59, 12 between 60 and 69, 13 between 70 and 79, 11 between 80 and 89, 9 between 90 and 99, and that is it for today. There are 60 females and 48 males. We know that 2 are hospitalized and that 1 is at home, but we do not have information on the remainder. Today, I'm sorry to share with you that 11 more Montgomery County residents have lost their lives to COVID-19, which brings our county total to 43 lives lost. All of these individuals died in the hospital. The first is a 62-year-old female from Lower Marion Township, a 72-year-old female from Cheltenham Township, an 83-year-old male from Upper Gwinnett Township, a 61-year-old female from Cheltenham Township, an 85-year-old male from Upper Gwinnett Township, an 86-year-old male from Upper Gwinnett Township, a 90-year-old male from Hatfield Township, a 90-year-old male from Ambler Borough, an 82-year-old female from Upper Gwinnett Township, a 48-year-old female from Norristown Borough, and a 93-year-old male from Upper Gwinnett Township. I have put together some information on the racial breakdown among the individuals that we have that information from here in Montgomery County. So to put this into perspective, if you look at the 2018 census data for the county, the racial breakdown is Caucasian, 79.4%, Black or African American, 9.1%, Asian is 7.5%, Hispanic Latino is 5%, and American Indian Alaskan Native is 0.1%. So I have information on all but 7 of those individuals that have passed away. This information is either reported by the family of the deceased or by whomever the coroner's office is getting the death report from. So we have 5 individuals that were identified as Asian, 2 as Asian Indian, 1 as Asian Korean, 4 as Black or African American, and 24 as Caucasian. And then we have 7 individuals where that information is not known. We had a call today with all of our major hospital systems in the county, and I am very pleased to tell you that thanks to everybody's hard work and staying at home, all of our hospitals have open beds, both in their regular beds and in their intensive care units, and all of our hospitals have ventilators available. So we're extremely pleased about that. We were also very pleased to hear the governor signed an executive order He announced it publicly a short while ago. We heard about it a little bit earlier today. That gives the state the ability to help move equipment, medical equipment, pharmaceuticals, and personal protective equipment from places that don't have as much need right now to places with high need today. So we are grateful that that flexibility has been made available to us, and hopefully we won't need it, but it's incredibly reassuring to know that it's there if we do. An update on our long-term care facilities. Just as a reminder, we have 75 long-term care facilities that are licensed by the Pennsylvania Department of Health in Montgomery County. Today, we have 51 facilities that are reporting positive cases of COVID-19. There are 37 facilities with 1 to 5 cases, 7 facilities with 6 to 10 cases, 5 facilities with 11 to 15 cases, 1 facility with 16 to 20 cases, and 1 facility with 21 to 25 cases. The total number of cases that are residents, that involve residents, are 155, and there are a total of 71 staff from these facilities that are positive. Our community-based testing site continues to be up and running. Today, I have to thank someone that I have neglected to thank this entire time, so they get an extra big thanks, and they've been there the whole time, which is the Community Ambulance Association of Ambler. I am sorry that I haven't thanked you before today, but we do want to acknowledge that you've been there from the start, and we are grateful for your service. In addition, I want to continue to thank Temple Ambler, the Temple University Police, Upper Dublin Township, the Pennsylvania National Guard, and the numerous county departments that are assisting with this effort. As of yesterday, we have tested 4,457 individuals. We have 64% of the results back, and we are now running 19%. So I'm very happy to see that. We had been ticking up there. We got up to 21% for the prior 2 days, but now we're back at 19. So hopefully that means that maybe this is our plateau. We shall see what the next few days bring. We do believe that we have enough supplies to get us through this Friday, April the 10th. The site will, unless something changes, be closing down this afternoon. I want to thank our federal delegation. They are working hard, led by Congresswoman Natalie Dean of this region, to convey to the federal government that we would like this site to remain open. So we want to thank them for our efforts, for their efforts on behalf of our county. In the event that the site does indeed close down, we are working to make a list of alternative sites available to you, and we'll hopefully be able to announce that by the end of the week, so you have some guidance on where the alternatives are. In terms of tomorrow, registration will open for slots for tomorrow's testing at 8 a.m. tomorrow morning. You can do that online at moncopa.org/COVID-19 under county testing information. Click on register for a test. Or if you don't have good internet or an email address, you can call 610-631-3000 and make an appointment over the phone. And finally, I want to acknowledge that tonight is the first night of Passover. And to all of our friends who will participate in this faith tradition, we wish you a very happy Passover. And thank you for making the personal sacrifice of celebrating this holiday with your household contacts only. We know this is an incredibly difficult and stressful time, and a time where families come together from all over. We hope that you are not planning an event like that. If you are planning an event like that, we ask you respectfully to change your plans. We've worked so hard here in the county to keep our curve pretty flat, and so far it looks pretty good. And we have to just persevere. We cannot give up, even when it's for something as important as a religious holiday of this magnitude. Please celebrate from a distance. Use the internet, use the telephone, whatever you have at your disposal, but please just stay with your household contacts. And with that, I will turn over to Commissioner Lawrence.
I would like to wish everyone who is celebrating a happy Passover as well. As I announced earlier this week, the Montco Strong Small Business Loan Program launched at 11 a.m. today. And not surprisingly, we have had tremendous demand. There have been 900 applications that have been submitted so far. Due to the tremendous demand and the limited funds available, no applications will be accepted after 5:30 p.m. today. And the website is absolutely working, but you have to be patient. You might have to submit more than once, but we've had no issues with the website going down at all, but there has been overload because of the tremendous demand. This $1 million fund is an initiative created by Montgomery County in partnership with the Redevelopment Authority, our department, and our Commerce Department. And the funding for the program is coming from Montgomery County Capital Budget Bond proceeds. Applications will be reviewed for completeness and eligibility, and we will begin to disperse funds as soon as possible. 501c3, 501c4, 501c6 organizations are not eligible for this funding, and eligible small businesses will have the opportunity to receive up to $25,000 to help with making rent or mortgage payments, meeting payroll expenses, and covering utility bills. And there will be a priority placed on companies who are maintaining their payroll through this pandemic. Links to the Montco Stronger Small Business Grant Program can be found on our Commerce Department's page at www.montcopa.org/commerce, as well as also on our Montgomery County COVID-19 Data Hub at www.montcopa.org/COVID-19. It includes all the information about program guidelines and application instructions. And we have a dedicated email account as well, which is montcostrong@montcopa.org. It will take some time to review applications, so please do not email tomorrow asking the status of your application. We once again want to thank the Montgomery County Redevelopment Authority, the chairman, Jonathan Spergel, and the board of directors, Jerry Nugent, who is the executive director, their solicitor, and David Zellers, our director of commerce, and his department, who's been working very hard today to get these applications in. I'd also like to make an announcement about early intervention services. If you have babies or young children with developmental delays and disabilities, early intervention services are still available during this COVID-19 pandemic. Infants and toddlers keep developing and our families need support. Montgomery County Early Intervention is free and here to help, conducting evaluations, remotely providing therapy, and holding meetings with families virtually. If you are the parent of an infant or toddler from birth to 3 years of age and you're living in Montgomery County, PA, and you have questions about your child's development, please call 610-277-7176. That's 610-277-7176. With that, I'll turn it over to Commissioner Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. I'd like to begin by acknowledging that this week is National Public Health Week, so I'd like to thank all our workers in the public health field. It is also Holy Week. Passover began this week. We have Good Friday this week, and this weekend is Easter Sunday. And I want all our public health workers to know that I'm thankful for them and I'm praying for them every day during this pandemic, not only this week. Today, I want to warn you about a new fraud and scam tactics out there designed to trick you into disclosing your personal information. Unfortunately, bad people take advantage of a crisis like this to steal personal data. You should take steps to protect yourself from phishing scams that are targeting people who are expecting a stimulus payment from the federal government. We want to remind everyone that you should not provide your direct deposit or other banking information to anyone who contacts you on the phone, through email, text messages, or social media. According to the IRS, the economic impact payments that are being distributed by the federal government will in most cases be paid by direct deposit into the bank accounts that taxpayers listed on their federal tax returns. However, the IRS has reported seeing a surge of scam artists posing as government officials to trick people into turning over their banking information. Doing so may allow a criminal to steal your identity, file a fraudulent tax return in your name, or use your personal data for other illicit purposes. If you have received unsolicited email or phone calls asking for your personal or financial information, the safest response is to delete the email or hang up the phone. There are a few things you should look out for to help you recognize these scams. Scammers may emphasize the words stimulus check or stimulus payment, when the official term is actually economic impact payment. Scammers may ask the taxpayer to sign over their economic impact payment check to them. The scammers may call, email, or text you for verification of personal or banking information, saying that the information is needed to receive or speed up your economic impact payment. They may suggest that they can get a tax refund or economic impact payment faster by working on the taxpayer's behalf. This scam could be conducted by social media or even in person. We have seen instances where scammers mail the taxpayer a bogus check, perhaps in an odd amount, then tell the taxpayer to call a number to verify information online in order to cash it. To avoid these scams, be on the lookout for imposters. Many times these criminals will pose as government entities or an official business. If you are targeted by a scam artist through the mail, phone, or email, do not provide personal information or money until you are sure you are speaking to a legitimate representative. When using email, be aware of unusual attachments and links. Links to a website or attachments to an email could be infected with malware that's downloaded as malicious software. Spyware can track the recipient's keystrokes to obtain passwords, social security numbers, credit card numbers, or other sensitive information. Please be careful and help your family, your friends, and your neighbors avoid these scams that are currently taking place. Thank you very much, and I'll turn it back to Commissioner Arbush.
All right, happy to take questions.
With the long-term care numbers, are you tracking the number of fatalities or deaths from long-term care facilities?
I don't have that information.
And is there anything to take from those numbers? Are you learning anything or
So we shared those numbers with our hospitals today on our hospital call, just to give them a sense of, just to help them increase their awareness as we all are working together to plan for any needs when it comes to surge capacity. We don't think we're at quite the top of our peak yet, and so as we look out the next week to 10 days, we just want to make sure that everybody has all the awareness that we do across our hospital systems and that everyone's planning accordingly.
Any issues with staffing the long-term care facilities, and how would that take place if you have more staff members fall ill that can't work?
I don't have any information on that. I remind you that these entities are licensed by the Pennsylvania Department of Health, and we've just been making really the equivalent of sort of courtesy calls to see if we can offer them any guidance on how to follow the CDC guidelines for infection control, things like that, and also just getting these numbers so we have our ability to help plan for surge. So the Department of Health, the Pennsylvania Department of Health should be who they should be going to if they have those kinds of challenges.
The governor mentioned 1,800 Pennsylvanians are in hospital beds. Do we have a current number of how many in Montgomery County?
Yes, we are sitting, again, I think I mentioned this 2 days ago, we're still right at about 250. So I know that based on our call today with the hospitals, some hospitals have been able to discharge some people, which is great news. Those people have been largely replaced, so we're staying pretty steady right now.
And not all hospital cases mean the person's on a ventilator.
Oh, that's absolutely correct, yes. Only a percentage of the 250 are on ventilators. The state did launch a new website today, and that website does have some numbers about how many people are on ventilators. I don't know if it's specific to in as much detail as they're on a ventilator because of COVID-19, or they're just on ventilators, right, for whatever reason. But the good news is that there are a number of unused ventilators in the county right now.
I just want to clarify, you talked about the testing site, making reference to Congresswoman Dean. There's efforts then to keep this going beyond Friday, but
Yes.
that's still, right now Friday's the day, but it could be extended.
Congresswoman Dean has sent a letter and has led an effort across our federal delegation to ask federal HHS to keep the site open. But I think that for planning purposes, we are assuming that the site will close on Friday at the end of the day.
We've talked about the number of cases each day and how that can vary. Do you read anything into the number of deaths announced today, or is that kind of the same where it can vary? Is that a trend perhaps?
So just like the fact that we do not get all of our data back from the lab in a nice sequential order, we don't always get notified about deaths on the day that they happened. And so the deaths that I'm reporting today, I don't have the numbers in front of me, but they are from a couple of days, yesterday, the day before, maybe even there might be one or two from the day before that. And it just has to do with the way the data comes into our coroner. But we are definitely seeing a trend up, and as I think we talked about maybe a week, 10 days ago, that deaths, even once we've reached our peak, which I don't believe we have, but even once we have and are on our way back down in terms of number of new cases, we would continue to see maybe even an increase in deaths for a little while longer, because that just takes a while to happen. Most people are going to the hospital, spending some time there before they actually succumb to the disease. So we would continue to expect to see deaths even when we're on our way down from the peak.
One more on long-term care. When a patient is diagnosed in the facility, are they then taken to the hospital, or are they treated at the facility?
So the question was, if a patient in a long-term care facility is diagnosed with COVID-19, where are they treated? Just like anyone else, if their symptoms are relatively mild and can be managed in place, they're managed in place. But if the symptoms become more severe, they call 911 and are taken to the hospital. Teresa, anything from
No.
press outside? Anything else? Okay, great. We'll see you tomorrow at 3. Thank you.